Hi, I'm Brian, Territory Manager for Michigan, and this is MamaNatalie. MamaNatalie, as you can see, is a very portable, very realistic, cost-effective simulator from Laerdal. Comes in this great backpack. It's very portable, very easy to carry around, and let's show you a couple of the key features to it. Okay, MamaNatalie offers a lot of great features for educators to use within obstetrical training. As you can see, the main portion, the actual birthing simulator of MamaNatalie here, I've actually attached to one of the simulator mannequins that I have. But it's actually best utilized by being worn by one of your standardized patients that can actually control the actual birthing of the neonatally and actually control the bleeding and a lot of the other features that are essential to the simulator. Let's take a look at those now. Okay, this portion right here is actually neonatally. This is actually the neonatal baby. And what's great about this is it's realistic size, it's realistic weight, especially when you fill it with warm water. You can also fill it with air if you need to, but it's a lot more realistic. As you can see, I've got it filled with warm water here. The great feature about this is that you can actually simulate breathing. So that opens up a whole lot of other educational opportunities to teach with. And you can also do umbilical cord pulses by pressing the red bulb here. I don't know if you can see it that great from the camera, but definitely feels and looks like a real neonate. Attached here is the actual placenta, and from here you can actually do complete placental deliveries, or you can actually do partial and have a retained segment there. So another great feature. Okay, as you can see, I've placed neonatally inside the birthing simulator here. And another great feature of this is that typically you would have a standardized patient that would be actually pushing the neonatally out through the birthing canal. And at this point you would be able to simulate a lot of the different stages of labor. You'd also be able to show the different positions of the neonate at this point. You would actually be able to suction the baby at this point. And it also comes with this great bulb here, so you can actually simulate the crying or lack of crying if you want to go down that road for training purposes. Now, another great feature of MamaNatalie is it has the ability to, with simulated blood, to show bleeding, like postpartum hemorrhage, which, as we all know, is one of the most deadly forms of, or complications rather, of birthing. And you can actually see here that with the system inside, the standardized patient is actually able to mix some water with some red food coloring to simulate blood, and you can actually adjust the amount of flow coming out, which is another great feature for educational purposes to show what to do in the event of severe postpartum hemorrhage. Okay, as you can see at this point, we've actually delivered neonatally, and what's left here is the placenta, which you can actually show being delivered, like I said, as a complete or as a partial placental delivery. And you can also simulate nuchal cord and prolapse cord as well. Lots of different things to educate with that it's capable of doing. So lots of great features. Just to recap, it is a MamaNatalie. This is a very cost-effective, very realistic simulator that can perform a lot of different educational objectives, all the way from maternal to newborn care. So contact your local Laerdal representative for a demonstration. Thanks for your time.